Welcome to this week's video all about cold sores. If you've got a cold sore on your lip right now and you have found this video, well my friends, you've found the right video because we're going to be going through cold sore treatments and how to get rid of a cold sore. So let's begin. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare, so I really hope you find this information helpful. There is going to be a chapter in the description below. If you want to find any specific section, feel free to click on it and go to that specific section and find out the information. However, I would always recommend you watch the entire video. That way you're going to become a bit of a cold sore treatment pro type person. Also, please don't forget to click that like button if you find any of this information helpful. It's going to help me, it's going to help the video, it's going to help the video perform better, and it's going to make the video available to more and more people around the world to help them as well if they're suffering from a cold sore. Now let's begin. So let's begin with some basic science. What is a cold sore? Cold sores are little red blisters that you get usually around the lip area or around the nose area, and it's believed that 2/3 of people under the age of 50 are affected with cold sores, and unfortunately if you do have cold sores you've most likely got them from someone else. So cold sores are caused by a virus called herpes simplex virus, and like I said, they're spread by other people passing it to each other. Also, please remember you can spread cold sores even without having an active cold sore as well, so bear that in mind as well. They are very, very contagious, hence why 2/3 of people under 50 have cold sores. And once you have the virus, it then lies dormant within your nerve sheath. It doesn't mean it's a life sentence that you're going to have cold sores all the time, but they can lie dormant there and eventually they get activated for whatever reason, whatever the factor that's stressing you out, for example, and then you get a cold sore, gets activated, and then you get the little red blister that we all know so very well. So the first thing I want to talk to you all about is the factors that actually cause the cold sores. Look, because we know that once you have a cold sore, it's going to reoccur because we now know the science behind it. So if you can do certain things that are going to reduce your chances of having a flare-up, well, it makes sense to know them and do them first. So for example, stress can make cold sores worse, so you need to work out ways to reduce your stress levels. Now I do have loads of videos on reducing your stress levels and techniques that can actually help reduce your stress levels, so if you want to find more information on there, I'll leave a link up here and in the description below. Other things that can cause it, for example, are direct sunlight. Look, if you're going on holiday, if it's getting sunny all of a sudden in the UK, which is quite rare, but even still, you should be using an SPF. So we're talking SPF 15. If you get it on your lips all the time, using an SPF lip balm can be really helpful as well, just to protect the skin and avoid causing those triggers to cause an outburst. Now, cold sores usually last for about 10 days, but there are things that you can do to help treat a cold sore. So we're now going to work through them. We're going to work through each step one by one, and let's hope that they help you. So moving on to tip number one. Remember, cold sores are caused by the herpes simplex virus, so we need an antiviral. Acyclovir is a common antiviral cream that we use for cold sores. It can be quite effective at reducing the number of days of the duration of the actual cold sore, especially if you hit it straight away as soon as you feel those symptoms. Look, if you've had cold sores before, you're gonna know what symptoms you experience before you get your outbreak. You start to feel tingly, it might start to feel numb around the area, and as soon as you start to feel those symptoms, that is the point where you need to hit it. You need to be aggressive with therapy, that's what we call it. You need to be aggressive with it and put the acyclovir on. Now the acyclovir cream, you can buy it from any chemist, it's available. I'm not sure if you can buy it from all supermarkets, but you can definitely buy it from all the chemists, and you apply it 5 times a day, okay? When you're applying it, you just need to dab it on the area. You don't need to dab it elsewhere, just dab it on the area. Well, first of all, make sure you wash your hands, especially with COVID and everything going about at the moment. You need to make sure you first wash your hands before you're touching anything on your lips, because if you touch it on your lips, most likely eventually gonna go in your mouth as well. So wash your hands, dab it on the area, and then wash your hands again. Also, the other reason why you need to wash your hands after is because you've just touched an area which has an active cold sore. So there's active herpes simplex virus there. So if you touched it and then, I don't know, you shake someone's hand, then they're gonna be at risk of getting herpes simplex, especially if they don't have it already. So please bear that in mind as well. So acyclovir cream is our first option, which is actually very, very effective. But remember, you need to be aggressive. So to summarize, you need to be aggressive. So as soon as you feel those symptoms, have it ready. So don't wait until you get the symptoms and then go to the chemist tomorrow to buy it. Have that cream ready. If you're someone who suffers from cold sores, it's important you just got that ready so you can just go for it straight away. So as I said, you need to dab on the acyclovir 5 times a day. It's usually recommended to use it for about 4 days. However, if it's still persisting, the cold sore, you can use it for up to 10 days. There's no harm in doing that, so feel free to use it for up to 10 days if you want. But bear in mind, if your blister's still active after 10 days and it's not getting any better, please do speak to your healthcare professional about it, because it's very important, because there could actually be another infection going on as well. So if it's not recovering after 10 days, then definitely speak to your healthcare professional about it. Now, one thing that cold sores are notoriously well known for when I speak to my patients about them is the pain. They can be very, very painful. That inflammation in the area can really be painful, especially because we have so many nerves around the area, such as the mouth, for example. When there is an inflammation, that's why there's so much pain there, because our mouth has a lot of sensitivity around it compared to other parts of our body. So when you get inflammation there compared to, let's say, my arm over here, it's not going to be as painful if I get a bit of swelling here, but around there, it's really going to hurt. So if you do get the pain that cold sores are notoriously well known for, you can take paracetamol, ibuprofen for it. They're completely fine to take for it. However, please do remember, always check with your healthcare professional if you are safe and suitable to use these medicines, because that is the most important thing. And always read the information leaflet that comes with it, again, just to check that you're safe and suitable to use that medication, because I'm going to say it again, your health is the most important thing. Now, in terms of other treatments, you can also get cold sore patches that you apply to the area that help protect the skin around it. There's also some electronic devices that apparently help with cold sores, but please do remember, there isn't really any evidence supporting any of these. The patches, especially the electronic devices for these, I don't really think there's any evidence. Well, we've looked for evidence, but we couldn't find anything that actually helps support them. So don't go and waste your money on that. Just stick with acyclovir cream. We've been using that for years. It works well for patients, but you just need to be aggressive and hit it straight away. I know I keep saying it, but I need to overemphasize that point, because it's really important that you do it properly. If you hit it soon and quickly before it gets large, you're going to be very likely to stop it from spreading and getting much bigger, and like what it usually does when you have an outbreak. Okay, so now we spoke about cold sore treatments. The next thing I want to talk to you about is self-care, lifestyle advice, things that are going to help as well. The first things, you're going to need to go to a chemist to get, the medication, but these things everyone can do at home. They're inexpensive and easy peasy to do. So the number one most important self-care tip for cold sores is do not touch the cold sore. Unless you're applying your product on the acyclovir, do not touch it. You're just going to aggravate it, okay? This is a very sensitive blister, and if you keep touching it and playing with it, you're just going to aggravate things, and then you could potentially cause a rupture as well by breaking the skin, and you could potentially cause scarring and all the other stuff. And also remember, like I said, if you're going to touch it, your fingers then got what on it? Yes, the herpes simplex virus. So that means you're going to be spreading it everywhere to other people who I'm pretty sure they don't want a cold sore, okay? So please remember that, do not touch it. Unless you're applying the actual acyclovir, do not touch the area. Now, there are also a few things you definitely need to avoid when you have a cold sore. For example, kissing is a no, because you're going to spread that herpes simplex. Also, oral sex is a no, again, because you're going to spread the virus. And also, sharing things that touch your face. So for example, towels. Never share a towel when you have an active cold sore. In fact, never share a towel generally. Everyone should have their own towel. This is one of the most important things, just to reduce the spread of different diseases and bacteria and viruses and everything. Everyone should have their own towels. So please have your own towel. Also, don't share stuff that touches your lips. So for example, cutlery maybe, lipstick, anything like that that's going to touch your face or lips. Please don't share it, just keep it to yourself. Now, cold sores are also very contagious to newborn babies, so please remember that as well, that if, I don't know, you're seeing your nephew for the first time, please avoid kissing them, because again, it's just going to spread that cold sore and that herpes simplex virus to the baby, and I'm sure they don't want that either. So please remember that, because a lot of people never think about babies, and babies are really important because they are very high risk of catching the herpes simplex virus. So remember, if you do have cold sores, especially an active one, and you're seeing the baby for the first time, don't kiss it, just be nice to it. Okay, so that's lifestyle advice done. There are a few times where you should seek medical attention for a cold sore. A box is going to pop up here with different bits of information on when you should seek medical attention for a cold sore. Feel free to pause the video right now, give it a read. If it applies to you, then please seek medical attention for the cold sore. Okay, so it looks like we've come to the end of this video, all about cold sores on the lips and how to treat a cold sore. So I really hope that you found this information helpful. Remember, the moral of the story story is acyclovir, aggressive, straight away as soon as you get symptoms. I was trying to do it in single words, but it didn't really work. I really hope that you find this information helpful. Please do let us know any of your own tips as well. Leave a comment in the description below. I'd love to read it, and I'm sure everyone else watching this video would love to as well. As I always say at the end of each video, well, before I say this, please don't forget to like the video as well. If you found any of this information helpful, don't forget to give it a like. I will really appreciate it. It'll help me, it'll help the video, it'll help the video become, you know, more apparent to other people so they can watch it and learn this information as well. So please don't forget to click that like. And now back to what I was saying. As I always say at the end of every single video, always remember that you're awesome, and I will see you next week. Dormant in your nerve sheaths and does so tip number one, so okay. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.